In the vast landscape of healthcare, a disheartening reality often goes unnoticed: the significant amount of wasted medicines. Every day, countless medications intended to alleviate suffering and improve lives end up unused and discarded. This wastage not only squanders valuable resources, but also hinders our ability to address the healthcare needs of communities worldwide. I'm Tej, and in today's episode, we delve into the complexities surrounding this issue, examining its causes, implications, and the potential for change. GivMed is a non-profit organization aiming at facilitating access to medicines for all. With us today is Stamatis Psaroudakis, the Medicines Donations and Programs Coordinator of this amazing non-profit. Welcome to the podcast, Stamatis.
Hello, Tej. Thank you so much for having me. We're happy to be doing this to you today and talk more about what GivMed does.
Wonderful. I have always wondered what happens to those medicines. You know, in my house, I would probably have maybe 5, 10, 15 medicines that have gone past the expiry date just because I didn't have anybody to give them to, or they were not needed at my house. So tell us, how do we end this process of, ending up in landfills?
Excellent question, and this is what we do here at GivMed to address this issue. Let me maybe perhaps give some background information about what GivMed does, our mission,
yes, please,
and what we do to facilitate access to medicine for everyone. So GivMed is a non-profit organization established in March of 2016 and founded by Thanasis Vratimos and Teti Psarou. And our mission is to ensure that all people have equitable access to medicines and health products. Now, this mission is accelerated with activities which are built upon 4 axes. The first one is we built a network of both public and private actors for the donation of medicine in socially vulnerable groups by redistributing and donating unused medicines and health products. Second, we inform the public and raise awareness on the possibility to donate leftover medicines and on matters related to medicine inaccessibility. Third, we improve the legislative framework, again regarding the donation of medicine, but also medicine accessibility. And fourth, we provide training to socially vulnerable groups and health professionals on medicine-related issues. Till now, GivMed in the last 7 years has dispensed more than 780,000 packs of medicine and hygiene products, worth 6,955,000 euros. Our operations are mainly focusing on Greece. We're a Greek-based organization, and in our country, 1.9 million people live below the poverty threshold. This is almost a fifth of the total population. And among those people, almost 80% of them are struggling to cover healthcare costs. We've also been running humanitarian aid actions abroad since 2021. We've already donated to Lebanon, recently to Syria and Turkey following the earthquake aftermath of February 2023, and to Ukraine due to the ongoing war. Now, this is the big picture of what we do. Zooming in a bit, essentially what we do is that we try to cover the needs of public benefit organizations who support socially vulnerable groups, providing access to the medicine and hygiene products they need. Now, these groups can vary. It can be the elderly, it can be children, poor people, refugees, migrants, people living with mental health conditions, and so on. So we've created a network of 187 public benefit organizations in Greece. Now, these organizations can be social pharmacies. This is a concept that exists in Greece. A social pharmacy is an organization that provides free medicine to socially vulnerable individuals meeting specific socioeconomic criteria. But other organizations can be shelters, NGOs, nursing homes. So what we do with these organizations is that we've provided them with GivMed software for free, which allows them to monitor their pharmacy, like a digital storage system, to see their needs and surplus, to add to the software the needs and surplus in medicines and hygiene products, and essentially to receive and donate those products. To enter this network, an organization must have one person among their health personnel, which is typically a pharmacist, who will be responsible to check and distribute the medicines and hygiene products. Besides this network, we also have a network of 27 public entities. This can be hospitals and health centers, when we enable them to donate leftover medicines and health products between them. So all of these donations that we've been coordinating here at GivMed, they come from these two networks, the 187 public benefit organizations and the 27 public health entities, but they also come from thousands of individuals who we enable them to donate their surplus medicines. They come from 43 pharmaceutical and health product companies who also wish to donate unused medicines before they expire to the network to support socially vulnerable groups. And also GivMed occasionally holds social responsibility actions with companies. So far we've done so with 22 companies. So this is the bigger picture of what we do.
Wow.
Now you said
that's amazing. And I'm
Please.
Yes, I'm surprised at, I'm in awe of the logistics of this entire thing, right? So you have agencies, you have collaborators, you have individuals, and how do you coordinate with all that? I mean, I'll come to that later, but if you could just tell us about the specific initiatives or programs that you undertake to, address this issue. How do you approach them? How do they donate to you, and how are these distributed?
So we have various programs. We've developed various software. So the first software is Med for NGOs, it's called. And this is a software where organizations can donate their surplus medicine and hygiene products to other organizations belonging within the network. And they try to meet each other's needs so that no medicine or hygiene products goes to waste. This way, the redistribution of pharmaceuticals is done efficiently and quickly. So in a nutshell, GivMed records excess medicines and hygiene products to be donated and matching with existing needs of other organizations. And we also coordinate the donation with shipments from a Greek courier company. It's called ACS. And they cover a big part of the shipments pro bono. So it's important here, I think, to highlight that GivMed coordinates the donation. So we do not receive, we do not store, we do not distribute medicines or health products. We do not control their quality. This is the responsibility of the health professionals of the organizations, which again, usually it's typically pharmacists. But we also have developed a software called Med for You, which is an app where individuals who are in a vulnerable situation, they can seek and identify from which public benefit organization they can receive the medicine they need. So, for example, let's say I'm based in Athens, Greece, and I need 1 box of paracetamol. So I can go to the Med for You app and see which organization from GivMed's network has this box of paracetamol, which is the necessary documentation I must have to go and obtain it, and then I can just go and obtain it. This is again only for vulnerable, socially vulnerable individuals. They must meet specific socioeconomic criteria, so it's not for the general population. And this app is translated into 6 languages. It's in English, in Greek, French, Arabic, Persian, and Ukrainian, so it's more linguistically inclusive.
Wow, you've thought of everything.
We've also thought of individuals who wish to donate, which was your first question. So we also enable individuals throughout Greece to place donations. We enable and help them to donate their surplus medicine and hygiene products to 144 donation points across Greece. So they can either give us a call and tell us where they are, what they want to donate, and we will direct them to the closest donation points to them. Or they can also go to GivMed.org. We have an interactive map where one can search for the region they want to donate to and find an organization close by. Of course, we also provide useful information on what can be donated.
Amazing. That's really amazing. Very efficient. A small question that arises out of this answer here is, what if somebody has medicines to donate and they don't really have the expiry date printed on it? Perhaps they have used that part of the medicine, or for some reason the expiry date is not visible to them. In that case, it is not valid, is it?
Well, for an organization to accept a donation, they must make sure the health professionals that we work with, they must make sure that this box or any product has not expired in order to accept this donation. If it occurs that the product has expired, then this, of course, should be properly disposed.
Right. Coming to this question of why do we have wastage of medicines? What are the primary causes or factors?
Yeah, waste of medicines is a global problem, and it's also causing an annual loss. For example, in the US, it's estimated that it causes an annual loss up to 5.4 billion US dollars, or 300 million British pounds in the UK. In Greece, the Greek Ministry of Health estimates that every year medicine that's worth of 1 billion euro ends up in trash. Also, GivMed had conducted a research a few years ago and found out that 34 million packs of medicine expire in Greek households annually. Now, why medicine expire? For various reasons. For example, our treatments end. I was sick, I bought a box of medicine, but I only ended up using half of it, and the rest I'm not going to need, so I can donate it. Or we have medications we keep at home in large quantities, and then we don't end up using all of them and they expire. Or we purchased some medication but we never use. Also, extensive amount of medicines are withdrawn from pharmaceutical companies and are destroyed due to forthcoming expiration dates because they cannot sell this medicine. So waste of medicine has a negative impact on public economies. It's a loss of profit for the country's economies. Also, fewer people, if we redistribute the medicines, fewer people would get sick because they're cured in time. Fewer people would go to the hospital. So again, this is a profit for country's economy. But also it has a negative impact on the environment, as you said. Chemicals end up in the wild. This poses a danger to the environment, but also to the public health. How? Well, for example, pharmaceuticals contaminate water and fish, affecting the growth, and through them they're returning to the human body from the food chain. So there's so many problems with medicine waste, but most importantly, I think, medicines that could be valuable for socially vulnerable individuals are thrown away, which is a tragedy.
Very true, very true. How does GivMed work to raise awareness about this issue?
GivMed does awareness actions. So we have awareness actions to the general public, informing them on safe use of medicines, about the possibility to donate, or also informing them about the proper disposal of medicines if they have expired. We also inform socially vulnerable groups for the Med4U app that they can go and they can search the medicines and hygiene products they need, and that they can go and collect it. So we do various events to increase our awareness actions. So this podcast, for example, is an excellent example of what to do for awareness campaign. But we're also very vocal on our social media. And also, if someone wants to check this out, we are GivMed at Facebook, GivMed Sir Medicine on Instagram, and GivMed Sir Medicine Sir Life on LinkedIn, YouTube, and Twitter, or X, now they've renamed themselves. We've also had campaigns airing in Greek television and in Greek radio. And These have all been successful because once people are aware that they can donate their non-expired surplus medicine and hygiene products, they actually do. And I think people are willing to donate once they're informed about it. I didn't know I was able to donate my leftover medicines before joining GivMed, and once I learned about it, I was happy to do so. And I think that's truth for most of the people.
Let's take a break to understand what Chezuba is. Everyone at some point ponders on how this beautiful life can be made more meaningful. Maybe you're a leader trying to enhance your employees' experience at your organization. Or you already work for the community and seek volunteers with state-of-the-art skills to strengthen your nonprofit. Whatever your situation, know that you can make a difference. Chezuba began with this very vision, a vision to facilitate every skill and every passion in the world in meeting a social need. Corporate volunteering has several benefits for both businesses and organizations. In parallel, experienced and enthusiastic volunteers join NGO workers, enabling them to serve the community more effectively. Chezuba offers everyone looking to add purpose and meaning to their lives a chance to connect or volunteer virtually with non-profit organizations from over 100 countries around the world. Visit www.chezuba.net and explore opportunities to find meaning. Chezuba, your platform to do good. And now, back with our guest. Yes, please tell us where else around the world, where else we can donate, because I'm sure every one of us has a set of medicines that, it could be multivitamins, it could be ordinary fever tablets, or you always end up having a little excess. So it's always good to know where to donate. If you have any collaborations across the world, are these displayed on your website? This is only for Greece?
This is only for the donation points so far in our website are for Greece. But if someone is outside of Greece and they would like to donate their leftover medicines, I would suggest them to search online for what options there are in their country, or also ask local organizations and NGOs that have a healthcare access focus. Maybe they would accept them.
Right. And is it okay if there's a small quantity also, or do you need to have a basic minimum that they can donate?
No. There is no need to be, there is no standard, there is no minimum. If someone has surplus medicines or hygiene products, regardless of the quantity, they can donate it. Also, this is a question we have, people usually ask, does it have to be a box full of a full package, a box of medicine? Mm-hmm. No, even if it's half of the box, so it's only some pills or tablets, you can still donate that.
Oh, that's wonderful. That's really amazing. Well, Stamatis, are there any success stories or notable achievements that, you read out a number of those achievements, numbers there. But do you remember of any one particular story that has, made you feel good that this is what you are doing and that's amazing?
Well, there is one story that really speaks to my heart. It's an event that occurred a few months ago and I won't forget it. So it was an organization who belongs to the program with public entities. So it was a health center in a hard-to-reach area. And they gave me a call. They were looking for a medicine for a 2-year-old child with leukemia, that this medicine would protect the patient, the child, from a bacterial infection. Thankfully, we were able at GivMed to quickly respond to this request and find a box of medicine within our network, immediately shipped it to them, and we saved the child was essentially protected from a bacterial infection, which could cost their life. Absolutely wonderful. At such times, you feel satisfied that you're doing the right thing, isn't it? Yeah, it's stories like that that keep us motivated, I think. to push forward.
Right. I'm sure this entire process comes with its set of challenges. So, what are the main challenges that you face in your effort?
Oh, I think the main challenge for us at GivMed is that we've realized that not many people are informed about the option that exists to donate leftover medicines and hygiene products. And this is something that we've been tackling since GivMed's establishment in 2016, just through our awareness campaign to inform as many people as possible that there is this capability, that medicines don't have to go bad, that they can actually save lives.
Yeah, true. Very true. And of course, you collaborate with healthcare institutions. You just spoke about the app which connects you to various healthcare institutions. You have two of them, right? Two stakeholders or two healthcare institutions that you have collaborated with?
Well, so the network that I mentioned that we've collaborated with includes 187 public benefit organizations, 27 public entities, but also again 43 companies, pharmaceutical and health product companies, 22 companies via their social responsibility actions, and thousands of individuals across Greece that are donating their surplus of medicines and health products. But besides that, we've also collaborated with other stakeholders. So through our missions, through our actions to improve the legislative framework, GivMed conducts research with partners as well. So this includes studying the laws and good practices that exist in other countries. And essentially, this aims to contribute to the creation of a national legal framework. So we've already actually submitted 2 legislative proposals to the Ministry of Health. And these actions, their final goal is to change the framework in Greece so that our work is not necessary anymore and everyone has access to medicine. But besides that, we also provide trainings. We provide trainings to socially vulnerable groups and health professionals on various medicine-related issues. So this could be access to medicines, medicine management, patient compliance with treatment, or also intercultural communication. And recently, GivMed also had the honor to be selected among 200 individuals and organizations globally by the United Nations to participate in the United Nations high-level meeting on universal health coverage in New York. That was 2 months ago. And we also had the honor to participate in the Growth Summit 2023 organized by the World Economic Forum in Geneva. So there we had the opportunity to raise the topic of the lack of access to medicine for socially vulnerable groups, the donation of unused medicines as a socioeconomic and environmental solution. And also the World Economic Forum shot and published on their webpage and social media accounts a video regarding GivMed's mission. It was GivMed's director, Ioanna, who spoke on behalf of GivMed about what we do on the video. Yeah.
Oh, that's wonderful. Great to know that you are reaching such forums and you're getting the awareness that the world needs today. Wonderful, wonderful. And I'm absolutely in awe of what you are doing. It is the need of the hour and something that perhaps ordinary people are not thinking about. So big kudos for that. How can I or how can anybody who wants to get involved or support you work? What can we do?
If a person is in Greece, they can call us or go to givmed.org to find places close by to them to donate leftover medicine and hygiene products. If a person lives abroad, they can follow us and share our social media accounts so that more people are informed about innovative ways to solve medicine waste and assist socially vulnerable groups. There is also the option, if someone is interested, to place a donation to assist GivMed's work. There is more info on our webpage on how to donate with options like bank transfer or PayPal. And also we have over 20 volunteers that helps us with various tasks, and we are welcoming new volunteers. Anyone is welcome to volunteer, regardless of where they live, especially if they have programming skills or data analyst and entry skills, expertise on medicine, Greek English translation skill. But if these are skills that someone doesn't have, I'm sure we could still find works to work together.
Find some work for them.
Yeah, they can get in touch with us. So more info on our webpage at givmed.org.
Lovely. And Chezuba is here for all your volunteer needs. So in case you require some volunteers for a specific task, we are always there.
Perfect. We have this noted. Thank you.
The consequences reach far beyond mere financial implications. Each wasted medication represents a missed opportunity to improve someone's health and well-being. It is incumbent upon us as individuals, as organizations, and society as a whole to come together and address this issue head on. Thank you so much, Stamatis. It was lovely talking to you and absolutely inspiring to know of the work that you are doing in getting this issue out of the way and dealing with healthcare the way you are. Thank you very much for talking to us.
Thank you very much for having me here, Tej, and thank you to Chezuba as well for raising awareness on the issue.